Hi, my name is Kweko. I am a pharmacist. In today's video, I'm going to be discussing groups of people that are at a high risk of developing magnesium deficiency. Now, some early signs of magnesium deficiency include loss of appetite, nausea, fatigue, and weakness. Now, if the deficiency is left unchecked and it progresses, then the side effects or the symptoms may begin to worsen. So now you begin to feel numbness, weakness, tingling, muscle contractions, and in very severe cases, even seizures. So it's definitely very important that we're making sure that we're eating foods high in magnesium or either taking a magnesium supplement just to make sure that you are where you're supposed to be. Now, the first set of people who are at a relatively higher risk of developing magnesium deficiency is the obvious one, people who don't get enough in their diet or dietary factors. Now, dietary factors can be divided into two broad groups. That is people who don't eat enough foods containing magnesium, and foods high or rich in magnesium include green leafy vegetables such as spinach, can also be found in legumes, nuts, and sometimes some fortified cereals, or even sometimes some bottled water will contain some amount of magnesium. So people for whom this is not a normal part of their diet tend to be low in magnesium. Now, to make matters even worse, some people may be consuming these foods, but there is reports to show that even the foods that are supposed to be high in magnesium these days are not as high in magnesium as back in the day due to intensive farming practices over the years, use of pesticides, and also even how much we process our foods these days. We kind of rob the foods of a lot of the nutrients just because of over-processing. There's also the other side of the coin where people are eating enough of these foods, but they are not absorbing them for several reasons. One of them being the fact that some people consume too many or too much saturated fats, and saturated fats prevent magnesium absorption in the intestines. Another fact that may reduce magnesium absorption is consumption of too much sugar. When you eat too much sugar, what happens is that the kidney, in a bit to get rid of the excess sugar, also gets rid of excess magnesium. So you have less magnesium being retained in the body to be absorbed. Now, talking about sugar, I also want to highlight another kind of problem, which is the consumption of carbonated drinks, soda especially. Now, some people may argue that, okay, I take a diet soda, it doesn't contain sugar, so I don't fall into that category. But the truth of the matter is that soda also adds other chemicals to your body. So for example, there's phosphorus, and magnesium may bind to this phosphorus, rendering it very difficult or nearly impossible to be absorbed into the system. So if you're drinking lots of soda, not only are you hurting yourself through the sugar, you're also adding other compounds to the body that reduces the absorption of magnesium. Number 2 on my list is older adults. Now, older adults are at a relatively higher risk of magnesium deficiency for a number of reasons. Number 1 is that they are generally less likely to eat foods that are high in magnesium. Number 2, as we grow older, the digestive system, or there's less magnesium absorption from the gut. I mean, that is just part of the growing up process. And also, older adults are more likely to excrete magnesium in the urine, as magnesium excretion from the urine generally increases with age. So as an older adult, you need to be paying a little bit more attention to your diet, and also to make sure that if you're really deficient, if your doctor says you're deficient, to consider a magnesium supplement. Number 3 is people with type 2 diabetes. Like I mentioned, the sugar, anytime you increase the concentration of sugar, it causes the kidney in an attempt to excrete that excess sugar, also excretes other stuff with it, and one of them is magnesium. So if you are type 2 diabetic, you are generally at a slightly elevated risk of being magnesium deficient just by the fact that you are excreting more magnesium from your urine. Number 4 is people who take certain medications. And with certain medications, I want to single out medications that are used to reduce acid in the stomach. So off the top of my head, I can think of Nexium, I can think of Prevacid, I can think of Prilosec. And I can also think of medications like Pepcid or famotidine, and I can also think of even general medications like Tums. The more you take these medications, the more you reduce the acidity in your stomach. And the fact of the matter is that magnesium is absorbed in an acidic environment. So anything that you do to continually reduce the level of acidity in your stomach means that you're creating an environment where magnesium is not well absorbed. Now, I totally understand that some people have to be on these medications because their acid production is, just out of hand. People with Zollinger-Ellison syndrome and other conditions like that, they just produce too much acid, and therefore there should be a way to mitigate that. I totally understand for those people, but this is just to bring your attention to the fact that the more of those medications that you take, the higher your risk of developing deficiencies in certain minerals and supplements such as magnesium, which need an acidic environment to be absorbed. Number 5 is people with excessive or uncontrolled stress. Now, stress is sometimes inevitable, the demands of everyday life, financial stresses, marital stresses, all the craziness that is going on in the world may cause us to become stressed. The truth of the matter is that the longer we are stressed, the body also releases hormones in a bit to counter that stress. And what those hormones also do is that they actually utilize magnesium. So the longer you are stressed, the more your body depletes itself of any stored magnesium, and the greater your risk of developing magnesium deficiency. So if there are any stresses in your life, I mean, it goes without saying that it is very important to eliminate such stresses in your life, just to make sure that you enjoy overall good health. Now, it's also an open secret that stress can also mess up your whole GI system, your whole gastrointestinal tract. So it can mess up the way you absorb certain, nutrients, essential nutrients, key of them being magnesium. The next one is people with alcohol dependence. Now, alcohol also, just like stress, also messes up your gastrointestinal system. It affects so many things and causes people to not absorb enough magnesium from even the little that they are getting from their food. And most people with alcohol dependence also generally don't tend to eat well. So you have two things working against you. Not only are these people not taking in enough nutrients, even the little that they are taking in, because alcohol messes up their system so much, they end up not absorbing enough to be up to the level where it's supposed to be. Number 7 is people with certain gastrointestinal diseases. Now, the diarrhea and the fat malabsorption that occurs in conditions like Crohn's affect the way you absorb magnesium. Certain other conditions like celiac disease also significantly affect the way you absorb magnesium from your food. So if you have any of these gastrointestinal diseases, it's definitely a good idea to keep a close eye on your magnesium levels. Anytime you see your labs, take a look at it, see where you are, and you and your doctor can decide the best course of action for you. Now, if you fall into any of these categories, I sincerely hope that you found some value in this video. If you did, please give it a thumbs up, and also stay blessed. Catch you in the next video.